Respected seniors, colleagues, and my dear friends, at the outset, I would like to thank the Journal of Orthopedics and Raju Vaishya sir for giving me this opportunity. And I will be talking on how to write methodology and results in a research article. These are the most important pillars on how we formulate a research article, and materials and methods and results are vital pillars. And today I will be talking on how we can clearly articulate our thoughts and our process in these materials and methods and the results so that it helps the editor and the reviewer and also the readers finally in clearly understanding what we intended to study in our research. I would like to share a small experience from my side. In 2019, the American Academy was in Las Vegas and I attended it. And anyone who's attended the Academy, you will understand that there are numerous sessions happening at very different times, all of very high quality. One of the very important sessions was how to publish your paper in high impact journals. And more importantly, of the five panelists, two of them were Professor Seth Leopold, who's the editor in chief of the CORR, and Professor Faris Haddad, who's the editor in chief of the BJJ. And the moderator for the session was Professor Mark Swintowski, who is the editor of the JBJS. Three big giants in the field who were also in this session. So naturally, there was a lot of hype about this, and it was a packed hall. And myself and my next speaker, Dr. Abhishek Vaish, we were fortunate to be there, and we attended this session. And always the most important thing, because I was starting my research career during that time in 2019, and I was just written about 2 3 papers, so I was a novice. But one very important thing which struck me during that time was all the three editors pointed out that every day they come across numerous submissions. The first thing how they used to assess whether this is a good paper, an average paper, or a poor paper is they go through the methodology. Methodology. This was the same term how Faris Haddad put it up. You have to give a very clear methodology, and that differentiates an average paper and a good paper from a poor paper. Of course, all the other facets are important. And the other important point which Seth Leopold clearly said was keep it simple. Don't think too much, don't need to plan too much. Keep it very simple and clear and concise. So with that background, how do we write methodology and results? So this was one of the collaborative studies which I was involved in, published in the Clinical Orthopedics and Related Research. With this as a reference, we will also see how do we write good methods and results. So whenever we plan methodology, it is important for us to define our study population. Who is the group you intend to study? And for that, using guidelines of Strobe, especially for all the retrospective non-randomized studies and consort for the randomized studies, you can go through these guidelines. Every single step is given there, what you need to do, what you do not need to do, what should you submit, what is essential, and following them, you will be able to deliver a very good, clear methods and results. Also, the entire structure of your paper. And whenever you study on a treatment or any intervention, clearly mention the diagnostic criteria used, how many patients were treated, how many were followed up, what was the minimal follow-up, and how many were lost to follow-up. And most importantly, complete your methodology with this: the primary outcomes, secondary outcomes. How did you answer each question? These are vital. And if we look at this specific question which we formulated, what proportion of patients with bone and soft tissue tumors contracted COVID-19 and died? That was the question. So in the methodology, we have to clearly define that it was a retrospective study. What was the time period between March 20 to May 30th? It was the initial phase of the pandemic. Where was the study done? 8 centers of the UK. What was the study number? 347 patients. So this has to come in your first paragraph of methodology. What was the primary outcome? How many patients contracted COVID-19? Secondary outcomes: associated mortality within 30 days and complications. And in our primary outcome and our secondary outcome, the next thing which you have to mention is how was each outcome assessed? what were the modalities, what were the treatments, what were the criteria used, how was the data collected. So in our patient, it was collected from the database of each hospital, and it was a simple observational study. Also, make sure you mention your key sources of bias, and that is important when you in your methods. And now when we come to the results, it's as simple. Answer each question. So each outcome which you have mentioned in your methods, answer it. And present the answers. For distributions, use mean or median with the 95% confidence interval and the p-value. Proportions, use the present odds and hazard ratio. For survivorship, always consider using a competing risks estimator much more than a Kaplan-Meier survivorship. Like if we have to articulate our results here, 1%, how many patients contracted COVID-19? 1% of patients contracted COVID-19 and they died in the hospital. The mortality risk among patients who contracted COVID-19 was greater than those who did not have COVID-19. When you say this statement, always back it up with your statistical analysis, as we have shown with our odds ratio and also our p-value with the confidence interval. Specific journals have specific criteria, so keep it very simple. You don't need to write many lines to exactly emphasize on your point. Keeping it very simple gives a better clarity, but back it up with statistics and evidence. And always the way you express holds a lot of key. Adding a table of how the entire process with all the inclusion criteria, with the exclusion criteria, how many patients were lost to follow up, how many did not fall into the criteria, how many formed your final group of analysis is very important. So always make sure that methodology is followed by a table, a representative table, and the results always make sure you draw a specific table where you give even the p-value, and you don't need to express every single aspect of the results in your text. You just need to just show it and also mention and reference your table in your text. And as we had mentioned, these are the top orthopedic journals today, all about 5, nearing 5, and the Lancet, which has an impact factor of 202, driven by pandemic sciences. All of them, as we had seen in that research symposium in the AOS, they look a very big part of their chunk of how they assess is given to methodology. So to summarize, methodology is most important, especially how editors and reviewers assess papers. Clearly define your outcomes, how you assessed your outcomes, and answer each question clearly using variables. Most importantly, keep it simple but keep it very clear. I thank you for your attention.